The word malaria came from two Italian words, mal, which means bad, and aria, which means air. This was due to the fact that initially the disease was thought to be resulted from swamp exhalations. Malaria is a mosquito-borne infectious disease primarily affecting humans and other animals. It is highly prevalent in tropical countries, and according to the WHO records 2019, more than 200 million cases of malaria were reported, with over 400,000 deaths around the world. Though it is transmitted primarily by the mosquitoes, malaria is actually caused by Plasmodium parasite. Transmission between humans are also known to occur through sharing sharp instruments with an infected person, blood transfusion from an infected person, as well as from an infected mother to her newborn. Plasmodia are coccidian parasites targeting red blood cells. For successful infection, they need two hosts for reproductive life cycle. They need mosquito as a definitive host and a human as an intermediate host. Their sexual phase occurs inside mosquito's gut and lead to the formation of sporozoids. Once the sporozoids are formed, they will move to the salivary glands, ready to be introduced during a blood meal. Their sexual phase, on the other hand, occurs inside the human liver, specifically in the hepatic parenchymal cells, which lead to the formation of merozoids, and these merozoids are the ones that happen to infect our red blood cells. There are a wide variety of Plasmodia species. So far, only 5 species are known to cause malaria to humans. These are Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowles. Plasmodium falciparum occurs exclusively in tropical and subtropical countries. They invade red blood cells at any stage, and multiple merozoids may happen to infect a single red blood cell. Once inside red blood cell, parasites are seen in more peripheral position, known as a cold position. Infected red blood cells do not enlarge, and myriadotes may be seen. They do not form hypnozoids, hence no relapses occur. Plasmodium falciparum have the shortest incubation period of about 7 to 10 days and cause a malignant tertian malaria. Malignant because its attacks are more severe and fatal if left untreated, and tertian signify that its attacks occurs periodical every 36 to 48 hours. Plasmodium vivax, the most prevalent type of Plasmodia. It invades only young and immature red blood cells. Once infected, red blood cell will enlarge and contain pink granules known as Schuffner dots. Trophozoites are seen with amoeboid appearance. Schizons may be seen containing up to 24 merozoids. They do form hypnozoids, therefore relapses may occur. Plasmodium vivax have an incubation period of about 10 to 17 days and cause a benign tertian malaria. Benign because patient may happen to tolerate the attacks, and it's tertian because attacks occurs every 48 hours. Plasmodium ovale primarily are distributed in tropical Africa. They invade young and immature red blood cells, and infected red blood cells usually enlarge and get distorted. Schuffner dots may be seen. Plasmodium ovale have the same clinical picture as Plasmodium vivax, as they all cause benign tertian malaria. Plasmodium malariae are the less prevalent human plasmodia. They only infect mature erythrocytes, and once infected, the red blood cell will not be changed in terms of the shape. Inside the RPC, there will be formation of band and bar forms, and there is no formation of hypnozoids, with therefore no relapses are expected to occur. Plasmodium malariae have the longest incubation period of about 18 to 40 days, and possibly months to years may also happen. Plasmodium knowledge species is mostly prevalent in Malaysia. Primarily, it affects old-world monkeys. They infect human red blood cells at any stage, results to high level of parasitemia, and also they have the same clinical picture as other species, and they cause what is known as a simian or quotidian malaria. It's simian because primarily it affects monkeys, and it's quotidian, which signify that the symptoms are daily symptoms. Patients with malaria may present with a wide variety of symptoms. The commonest symptoms include fever, chills, and headache. Some Plasmodium species, like Plasmodium falciparum, may happen to cause more severe complications, resulting onto cerebral malaria by affecting the brain, black water fever by affecting the kidneys, and abdominal pain, jaundice, diarrhea by affecting the liver. Laboratory diagnosis of malaria may involve several tests. This includes thin and thick blood films by using a microscope, the use of rapid diagnostic tests, RDTs. Also, serological tests may be used, though are not much recommended due to cross-reactivity between several different types of species. The treatment of malaria will be decided based upon the type of Plasmodium species causing malaria, the disease severity, as well as the part of the world where infection primarily and initially occurred. Several approaches are implicated as preventive measures for malaria. This includes being vaccinated, the use of chemoprophylactic medications like doxycycline, and also avoiding mosquito bites by controlling mosquito through the use of mosquito repellents, using mosquito nets, wearing long clothes to cover distal parts of the body, and also controlling mosquito breeding sites as a primary source to the mosquitoes. Thank you.